There are many common symptoms of ADD. The prefrontal cortex is the part of our brain that defines most what we are as human beings. This is the part of the brain that allows a person to focus on one task at a time. If this part of the brain is fully functioning, a person will be able to stay on task until completion. This is also the section of the brain that is able to think before deciding to take any action. Therefore, if there is dysfunction in the prefrontal cortex, some very common symptoms of ADD result. A person with attention deficit disorder is often distracted. They have difficulty screening out extraneous stimuli. Everyone takes in a tremendous amount of information spontaneously, but most people are able to focus on one thing in particular and allow all the other information to be picked up subconsciously and are therefore not distracted. People with ADD are often impatient and their minds work very quickly. They tend to jump at information instead of processing it slowly. They are often very interested in a particular subject but seem to figure out quickly where that information will take them, and then become bored and abandon that subject for another one. This tends to confuse other people and also results in tasks being left undone. Another symptom common with people suffering from attention deficit disorder is a tendency towards impulsivity. They often talk or act without sufficient intellectual consideration. This is similar to a chess player who only thinks about offense and does not have the patience to put themselves in their opponent's position. This impulsivity also results in high-risk activity without thinking ahead to possible disastrous consequences. People with ADD often become preoccupied and get lost in certain activities that are of personal interest, to the exclusion of important tasks that need to be done. This preoccupation shows itself in a number of areas. It is similar and related to hyperfocusing. People with ADD often get so lost in a video game or TV to the point that another person can walk in front of their line of vision and the person with ADD will not really see them. This tendency to be preoccupied is often misread by friends and families as if the person with ADD is simply rude, selfish, or uncaring. Another common ADD symptom is hyperactivity. It is important to remember that attention deficit disorder is the most general name for the medical condition. ADHD, or attention deficit disorder with hyperactivity, is a subtype and only one type of attention deficit disorder. When there is hyperactivity, it can take many forms. Often people will complain of feeling nervous and wound up, but will not show any overt hyperactivity. More typically, the person with ADHD will have problems sitting still, tend to intrude on others, and often keep time with their leg, foot, or hands. This has led Dr. Amen and others who are prominent in the field to hypothesize that ADD could actually be a small convulsive disorder. Almost all people with ADD have a lack of follow-through. One of the confusing things about this condition is how inconsistent it is. Essentially, if a person with ADD is enjoying the activity they are engaged in, there is often very little impairment. However, if a person finds the task boring, their brain essentially goes to sleep. When this occurs, it is hard to follow through. Someone observing this from the outside, such as a teacher or a parent, often mistakenly believes that this is proof of the child or adult just not caring or being lazy, or they view it as outright defiance, and this is rarely the case. Procrastination is a similar symptom that is rampant in clients with attention deficit disorder. People with ADD often wait until the last moment. Even if their motivation is high, they will often procrastinate.